Hello everyone. So today we will be doing episotomy, forcep, vacuum, and cesarean section. Okay. So all these are very small topics, but yeah, sometimes we get wrong on the questions from this topic. So all the important points in one go. Let's start it. So what is episotomy? Episotomy is the incision which we give in the vagina so that the baby can be delivered easily, right? So it's of two types. Number one is midline and the another is mediolateral. So midline is when we give a straight incision. In the diagram it's already shown on. Okay, so all are the advantages of the midline except one, and that's the major disadvantage, that we cannot extend this episotomy. Okay, so if we will extend this episotomy, then the anus will get tear, isn't it? So we don't want it to happen. So that's why we don't want the midline episotomy. We don't go for midline episotomy. We most commonly we go for mediolateral episotomy. Okay, and the this mediolateral episotomy can be extended up to large extent, whatever extent we want, because we know this a gluteal region is there. And this mediolateral episotomy, it just makes an angle of 60 degree from the midline. So the second incision which is shown in the diagram is mediolateral episotomy. Okay, when I said you all are the advantages of midline episotomy except one, so what are all the advantages? That is very easy to give and very easy to repair. The episotomy heals very easily. The dyspareunia is very less and infection is very less in the midline episotomy. So all are the advantages of the midline episotomy except one, that cannot be extended. Due to just this disadvantage, we don't give the midline episotomy. We always give mediolateral episotomy. Okay, so that was all about episotomy. Nothing else is asked. You just should know the angle of the mediolateral. It is from the midline, it makes angle of 60 degree, right? Let's now discuss forcep. Now what is forcep? Forcep is the instrument which we use to pull the fetus out of the vagina. So what are the indications? Its indication are heart diseases. When the mother has a heart diseases, then just to cut short the second stage, we give the force, we apply the forcep. And the another indication is decreased bear down efforts and deep transverse arrest. So these are the three indications we apply the forcep. So these are not asked. So only the heart diseases wala part is asked. How we manage the second stage of the heart diseases, mother with heart diseases, there we have to see we cut short it by forcep or vacuum, anything which we can apply. Okay, so let's see contraindications. What are the contraindications of the forcep? So what all are will be the contraindications of the forcep will be the first two contraindication of the forcep will be the indication of vacuum. Okay, let's see how. First of all, we cannot apply the forcep if cervix is not fully dilated, because forcep also occupy the space. So we have to insert that forcep near the fetal head. Here on the temporal region, we have to put both the forcep like this. So the cervix has to be fully dilated. So if cervix is not fully dilated, we cannot apply the forcep. Number one. Number two, if the rotation is more than 90 degree required, we cannot apply the forcep. If the rotation is more than 90 degrees required, ideally it is said that forceps don't rotate, but there are some forceps which can rotate. Even this forcep which is shown in the image, this is the outlet forcep. Even this can rotate. So in 90 degree, up to 90 degree rotation is possible, but not more than that. Okay, so all the fetal heads, they have to come occipito anterior in the last. So if it is a deep transverse arrest, at that situation we can apply the forcep, because the we can rotate the with the forcep 90 degree, but not more than that. So if it is occipito posterior, the sagittal suture or the occiput is in the posterior, so we can't use a forcep and rotate it up and make it occipito posterior. Okay, so not more than 90-degree rotation is not required. So the first our contraindication was if cervix is not fully dilated. Yes, vacuum can be applied if the cervix is not fully dilated. Rotation more than 90-degree required. This is the contraindication of forcep, but this is the indication of vacuum. So I already told you the first two, which are the contraindication of forcep, is the indication of vacuum. Let's see number third. Normal vaginal delivery not possible. Now in some situations normal vaginal delivery is not possible. For example, transverse lie, brow presentation, mento-posterior position in the case of the face. In all these three situations, no, we cannot use forceps, we cannot use vacuum. Okay, forceps and vacuums can only be used if the normal vaginal delivery is possible. Okay, so in the situations where normal vaginal delivery is not possible, it is not that we will apply the forceps and we can do it. No, it's not so. Okay, and number 4, station less than +2. So it is banned to apply the forceps if the station is less than +2. Even it is banned for the vacuum to apply. So only allowed is if the station is +2 or more, then only we can apply forceps and vacuum. So last two are common to both. Okay, and the above two is a contraindication only for the forceps, and they are indications for the vacuum. Okay, what are the side effects? As you know, the force, all the force is shared by most of the force is shared by the vagina. So vagina get teared a lot, episotomy get extended a lot. So side effect is maternal injuries. Okay, the side effect of the forceps is maternal injuries, maternal vaginal tears. Okay, so that was about the forceps. Now let's study the vacuum. What this is a vacuum we have to study. So as you all know, one thing more in the forceps I want to tell you, that this forceps is the less than if the station is less than +2, then we can't use the forceps or we can't use the vacuum. Earlier it was allowed, and when we use from 0 to +2, at that time it was known as mid forceps, and if the station is less than 0, then it was known as high forceps. So now only now as I told, the station less more than +2 is allowed. So in that case, the forceps which are applied at station more than +2 are known as outlet forceps, and its name is Wrigley's forceps. So this is the image of that forceps. As I already told you, station is at +2 or more, yeah, this +3 and all that. So it has a very less shaft. The shaft with which we hold the forceps is very less. So very small shaft, because the fetus is at +2, no need to insert it deep. We don't need to insert. So that is why shaft is very less. Okay. So now let's study vacuum. Vacuum, what are the contraindications of the vacuum? First of all, the vacuum is applied on the fetal head, and pressure goes to the scalp and the fetal head. So cephalohematoma is the side effect of the vacuum. So as I told you, all the injuries are on the fetus. So that is why we can't apply it on the fetal distress and fetal coagulopathies. Yes, as the first two are the contraindication of vacuum and are the indication of forceps. Okay, so fetal distress and fetal coagulopathy is a contraindication of vacuum, as already vacuum cause a lot of fetal injuries. So it is not given in fetal distress. Number 2 is non-vertex presentation. Okay, what do you mean by non-vertex? Like for example, if it is a face, mento interior, in the mento interior position of the face, the delivery can happen, normal delivery can happen. So if we have to apply the forceps, we can't apply on the mento interior position. Okay, and if we have to apply the forceps in the breech, we cannot apply. So vacuum can be applied only in the vertex presentation. In the non-vertex, for example in the breech and in the face presentation, mento interior, if it is required, we cannot apply. So it is must for the vacuum to have the vertex presentation. And yes, forcep can be applied in breech. You all know forcep can be applied in the mento anterior position of the face. So that these two are indications of forcep and contraindications of vacuum that we have studied. NVD not possible, I already studied it, we already talked about it. And station less than +2, that's all to be known about forcep and vacuum. Let's move to the next slide. Cesarean section. Now Cesarean section are of two types. One is lower segment cesarean section. You all know lower segment is made from the isthmus. The isthmus, which is 0.5 centimeter, lengthens to it increases its size up till 10 centimeter in the at term. So at that lower segment we give the incision, and it is a transverse incision on the isthmus, as the isthmus doesn't has muscle fibers, or very less it doesn't has a muscle fibers. So this scar does not rupture, and VBAC or TOLAC, what is vaginal birth after cesarean or trial of labor after cesarean, has high success rate in the case of the lower segment cesarean section. Okay, as a scar on the lower segment does not rupture again. Okay, now about classical cesarean section. In the classical cesarean section, we give incision on the upper segment in the vertical direction, and VBAC is not possible. VBAC is not possible because the chances of rupture are very high. Okay, now one new term has come, perimortem. Perimortem is, for example, a pregnant lady, we are resuscitating that pregnant lady, and we think that by doing cesarean we will help in resuscitation. Then and there in the emergency room only cesarean is done, and it hardly takes 4 minutes, and the resuscitation is continued. Yes, sometimes we can save the mother's life by doing cesarean. Okay, and here this cesarean is always of classical type, that is incision is given on the upper segment. Okay, let's see some images. This is the images, first images of the retractor, Doyne's retractor, which we use in the cesarean section. This was one given in INSET exam, so it was asked, and the other, all the options were vaginal hysterectomy. One was vaginal hysterectomy, one was your Leafold's repair. So all the three were vaginal procedure. So here I want to tell you that this is a Doyne retractor which is used to retract the lower abdomen, the abdomen which is below the incision. We give an incision in the cesarean. So incision divides the abdomen into two parts, upper abdomen and lower abdomen. So to retract the lower abdomen. So in the vaginal procedures we don't use this Doyne retractor. We use this Doyne retractor only in the abdominal procedure, and that was the answer. Okay, so the another in the mid is the green Armitage, green GREEN, green Armitage. This is a forcep which we use to catch the angles for the on the uterus. I told you we give this card in transverse in the lower uterine lower segment we give the transverse scar incision, transverse incision. So to the ends of that incision is known as angle, and to hold that angles, because they bleed a lot, to hold that angle, this is a green Armitage forceps. The third and the last image is of the vacuum. So this is a manual vacuum. By compressing this like this, vacuum is created. Otherwise these days we connect these vacuum cup in with the vacuum machines. Okay, suction machines. That's it. That was all about the forcep, vacuum, cesarean and the episotomy. Such a small knowledge will cover your all these 4 topics very nicely. I hope you like this video. Do like, subscribe and share my channel. It will help me a lot. Thank you.